If you've been wondering whether a nutrient deficiency could be affecting your skin and whether it's actually making your acne worse, I'm going to run through the most common nutrient deficiencies I see in clients when I'm working one-to-one in clinic, and just give you some tips on how you can identify whether you have a nutrient deficiency, what to do if you do have one and how you can correct it, what can cause it, and of course how they can be affecting our skin as well. Now, I'm Amelia, I'm a nutritional therapist and skin specialist. I specialize in acne. So if you do need help trying to clear your acne, make sure you subscribe to the channel because I talk about acne and how you can clear it. Now, it's not very common for clients to have actually had a vitamin or mineral check done before they come to see me because it's not something that's really done if you do have a skin condition. The only time you'll have maybe had these things checked is if you're being investigated for other possible conditions or things that could be affecting the skin. So as an example, if you're being checked to see if you have polycystic ovarian syndrome, you might have some blood tests done and it may include some nutrient deficiencies just to rule out some of the symptoms that maybe you have. But nutrient levels are really important to make sure that they're optimal when it comes to healing the skin, because although a nutrient deficiency isn't going to be the cause of your acne, there's probably a lot of things that are impacting your skin. The skin needs a lot of nutrients to actually function correctly, build a healthy skin barrier, and actually be able to repair. And when we do have nutrient deficiencies, they can show up in the skin and as slow wound healing. So I'll run through the ones that I see most commonly and then give you some tips on how you can correct them or get your vitamin levels checked too. Now, I'm actually going to start with one of the most common nutrient deficiencies in the world, and that is iron. Now, iron probably isn't the first thing you think of when you are struggling with your skin, and you definitely shouldn't just supplement with iron without testing your levels, and that's because having levels of iron which are too high can actually cause some damage. So we only want to supplement with iron if you know that you have an iron deficiency. Now, you might have an iron deficiency because you don't eat foods that are rich in iron, or maybe you're vegan or vegetarian, and this can be a little bit more difficult to get the amount of iron that you need. So plant sources of iron aren't absorbed as well as the animal-based forms of iron. So non-heme is the plant version and heme is the animal-based version. If you do struggle with an iron deficiency, making sure that you're getting vitamin C in your diet, or you take a supplement that combines iron and vitamin C, helps with absorption. So that can be useful to make sure you're getting the most absorption from your food as possible. The second reason that you might be low in iron is that you're losing blood. So this is very common in women that are having regular menstrual cycles. So if you're having a period every month, you are losing blood. And if your period is heavier, then you might be at more risk of an iron deficiency because you're going to be losing a lot of blood each month. So if you do have a heavy period and you've not had your iron levels checked, I would recommend just doing it to rule it out anyway, because you could be at risk of a iron deficiency. Now, other ways that you might be losing iron is actually if there's any sort of internal bleeding, and this can be common in gut conditions, so things like IBD. And also with something like celiac disease, it can really affect how well you're absorbing iron. So if you're eating all the right things and you've got an iron deficiency, you don't have a heavy period, or maybe you don't have periods, you want to rule out that there isn't anything happening in the gut, because you should really be able to maintain your iron if you don't have any of the other issues. Another cause of an unexplained iron deficiency is actually H. pylori, which is a bacteria that you'll find in your stomach if you have it, and it can affect stomach acid levels, which then affects how well we absorb nutrients like iron. Now, with iron, I like to do a full iron panel. So this will include ferritin, which is the stores of iron, and then you want to look at serum iron, which is the level of iron in the blood. And then you've also got other markers like total iron binding capacity, which is looking at how hungry your body is for iron. So if you are deficient in iron, you'll see total iron binding capacity go up. And if you don't need any more iron, or your body's like, no, we don't need any more, we've got too much, you'll see it go down. So having that combination in a panel, as well as things like transferrin and transferrin saturation, gives you a really good indication of if you're deficient. So ferritin is a good way to look at how much you've got in storage. And if you go below, kind of depends on the lab, but usually below 13, that is flagged as a deficiency, and you may need a prescription form of iron to get your iron levels back up. But people can sit around 14, 15 for a while, and they've not actually gone low enough below the deficiency cusp, and it won't actually get flagged. And you could have all these symptoms like fatigue, feeling dizzy or lightheaded when you're standing, slow wound healing, feeling constantly cold, hair thinning or increased hair shedding, and you've had tests and nothing's been flagged, it's because you're just on the cusp. From an optimal perspective, I actually prefer ferritin levels to be at least 50. So if you're at 14, you are low, even if you've not gone into the point of a severe deficiency or going into anemia. Now, iron is actually a cofactor for collagen, so it helps with collagen production. If you are going to do a supplement, obviously you'll have tested first. Don't just take iron because you feel like you want to take iron. So test, see if you're deficient, take the iron supplement, and usually what will happen is you'll take it for about 4 weeks, and then you retest to see if you're responding to the supplement, and then you'll retest again in about 3 months' time just to see that you've got your ferritin levels up to a good level. And then depending on that, you can reduce the dosage of the iron and see if you maintain your ferritin levels. If it dips straight away and you're not able to maintain the iron, then it might just mean that you need to keep taking those iron supplements. And also, if you've not checked for underlying factors, you would want to check at this point, especially if you're not really responding to the treatment, you would want to check your gut health and other factors that could be affecting iron absorption. Second common nutrient deficiency I see, I'm actually going to put these two together because they work together, and that's B12 and folate. And I know that B12 and generally B vitamins get a bit of a bad reputation online when it comes to acne. I have written a blog about the effects of B12 and whether there's a link between worsening acne. It's quite long, so I'm going to say if you want more information about that, read the blog. I won't talk about it now. But B12 and folate are similar to, this deficiency is similar to iron, because B12 and folate are actually really important for red blood cell formation, and you can have a form of anemia which has been caused by low B12 or low folate. So this is why it's important, if you've got symptoms, that you actually want to do a big panel, because you could think, oh, I'm really tired and I feel dizzy and I'm cold all the time and I could be anemic, I'm going to take iron. But actually, if your iron levels are fine and you take iron unnecessarily and really you need B12, one, you're not going to see an improvement, and two, you could make things worse because high levels of iron are not great for us. So always check. I like to do all those three. I mean, I like to do a few vitamin and mineral checks, but if I need to be really specific, I like to do those three just to rule out any deficiency that could be affecting things like energy levels. Anyway, they also help with wound healing and delivering oxygen to the skin, which helps with how it functions. I like folate to be at around 15 to 25, and if it's below that, you want to make sure that, especially if it's very low, you want to make sure that there isn't a gut issue, because if there's any issues in the small intestine, it can really impact how well you absorb folate, because a lot of your nutrient absorption happens in the small intestine. Now, you could have an issue in the small intestine if there's an overgrowth of bacteria, like small intestinal bacterial overgrowth, or if you've got a condition like celiac disease or Crohn's, Crohn's can affect the small intestine, so it would just depend on the condition. But that could be affecting how well you absorb folate from food, as long as you're eating the things. So obviously we always want to make sure we're getting the food in first and then rule out underlying factors. B12, you can have a issue with if you've not got healthy levels of stomach acid. You need stomach acid to activate and absorb B12. So sometimes if there's an issue with stomach acid, which can come from a particular autoimmune condition, but also if you've got a H. pylori infection, it can affect stomach acid levels, which will then impact how well you absorb your B12. So we do just want to rule out there isn't an underlying issue. B12 deficiency can also cause pins and needles or tingling in the hands and feet. So if you do have that symptom, you'd want to get your B12 levels checked. I prefer B12 to be around 500 and up, but the deficiency might not be flagged until you're like 150 and below. And that would be when you're qualified or you need like a B12 injection. If you are deficient in B12, it's very important that you increase your B12 levels, because low B12 levels can cause some long-term damage. So you want to make sure that your B12 levels are good if you suffer with deficiencies. Next vitamin is another really common nutrient deficiency. I'm surprised if I actually see a client who has a good level of this vitamin, and that is vitamin D. Now, I'm based in the UK, so a lot of my clients are here, and unfortunately in the UK we can't make vitamin D naturally from the sun between the months of September to March. So that means even if you're going outside and spending time outside, you won't make vitamin D naturally. So that's why we do have an increased risk, because the sun isn't at the right angle for our bodies to naturally make vitamin D. Also, some people genetically just aren't that good at making vitamin D, and that will also put them at a higher risk. I always like to test vitamin D levels because although a lot of people will just say take vitamin D, it's really common to be deficient. If you're deficient, you're going to need a much higher dose than someone who's at a good level. Because if you're really deficient and you're not aware of it and you just take 400 IU, you're not going to see an improvement in anything because it's just a tiny drop in the ocean. You need a bigger dose for around a month or so to really increase your vitamin D levels. And I personally prefer the sprays because they're absorbed easier. It goes straight into the bloodstream from the mouth rather than taking a capsule. Now, in terms of vitamin D and skin health, vitamin D is essential for immune function. So if you're struggling with slow wound healing, your skin is quite inflamed, it's important to just rule out that there's not a vitamin D deficiency. There is also some research that suggests that the severity of certain skin conditions increases when there's a vitamin D deficiency, and by supplementing with vitamin D, we see an improvement in certain skin conditions, in the inflammation in the skin. But of course, you're going to get the most benefit if you've actually got a vitamin D deficiency. So if your vitamin D is optimal and you take vitamin D, you might not see that much of an improvement because you weren't really that deficient. So check your levels, see how deficient you are, and then you want to take it for about a month, and then you may retest to see how much it's increased, and then you'll be able to get a bit of an idea of a maintenance dose. Next nutrient that I'm going to chat about is, again, another one that we can test. So I'm doing all the ones that we can test easily first, and that is omega-3. Now, essential fats are so important for skin barrier function, and omega-3 actually really helps to reduce and regulate. Well, it helps to regulate the immune system. It helps to reduce inflammation. And again, if you've got inflamed, painful, cystic acne, we want to support the immune system as much as possible and help to reduce inflammation in the skin. Essential fatty acids work as a kind of glue to the skin cells. So imagine your skin as a brick wall. Now, if you have a healthy skin barrier, you're going to have a healthy brick wall. So think about a house. You want the walls to be sealed. They've got healthy bricks, which is your skin cells, and they've got a healthy cement or mortar keeping the bricks together. That's actually fat. So the things that keep your skin cells glued together is fats. If you don't eat fats or you're not absorbing your fats very well, your skin isn't going to have enough fats in the skin barrier. And you can think of this as like if you had a hole in your wall in your house. The wind's going to come in, the heat's going to go out, the rain's going to come in. The barrier is damaged, just like the skin barrier is damaged. So when that starts to break down, the skin can become more reactive. You can actually lose water through the skin, so the skin becomes dehydrated. The fats help to keep the water in, just like the walls of your house help to keep the heat in. And even in oily skin, if your skin barrier is damaged and you're losing water through the skin, you might notice that your skin actually becomes more oily. You need to make sure that the skin barrier is healthy because that's actually going to help to seal the skin, keep the water in, which is going to help to regulate oil production because dehydrated, oily skin is going to produce more oil because your skin is trying to regulate itself. In terms of why you'd be deficient, again, not eating the foods. If you don't eat fish, you're more likely to be deficient in omega-3 because oily fish is the best source. EPA and DHA are the two most important fats to help reduce inflammation. If you don't eat fish, you're not going to have very high levels of EPA and DHA, so you will most likely need a supplement. On a general basis for skin issues and inflammation, I like to have a combination of EPA and DHA at a level of 1 gram at least. Vitamin A is one that's spoken about a lot. I haven't mentioned it up until this point because we can't really test for it, and it's hard to know if you've got a vitamin A deficiency, but vitamin A deficiency has been linked to keratosis pilaris. It's the bumps that you get like on the back of the arm or the legs, and it can be quite a stubborn skin condition, but vitamin A is really important for how skin cell turnover happens and how we're producing skin cells. So if you've taken Roaccutane, you won't be able to take vitamin A, definitely not while you're on the medication, but also for a few months afterwards. I would say avoid for 6 months any vitamin A supplements. Some people genetically aren't very good at converting beta carotene, so the plant forms of vitamin A, into vitamin A, and that can put you at risk of a vitamin A deficiency, which might be affecting your skin and how well it heals. So in that case, if you did have a genetic issue, it's something you can test for. I do it in clinics. You just need to supplement with vitamin A. That would be how you get around it, or you're going to have to eat foods like liver. If you struggle with fat absorption, you've got a higher risk of being deficient in fat-soluble nutrients like vitamin A. And this can happen if you've had your gallbladder removed, or if you've got any issues with bile flow or liver function. Can impact bile flow, which then impacts how well you absorb fats. Also, small intestinal bacterial overgrowth affects how well you absorb fats. If I do a stool test and we can see that there's high levels of fat in the stool, or you can see that there's an overgrowth of bacteria in the small intestine, then I will give people a liquid form of vitamin A just to increase the dose quickly. Increase their levels quickly, because you're absorbing it straight from the mouth. And finally, the one that's probably spoken about the most, I've spoken about last, but zinc is a common nutrient deficiency in people who struggle with acne. You can test it in the blood. It's not the easiest test to get hold of, but some signs that maybe you're low in zinc can actually be that you're catching a lot of infections, because zinc is so important, again, for immune function. Slow wound healing. Sometimes if you get marks on your nails, now that can happen because you have knocked it, but if you have like white patches on your nails, sometimes it can be linked to a deficiency in zinc. And also if your nails are quite thin and flaky, it can be a zinc deficiency. It can be some other nutrient deficiencies as well. If you know that you've got an issue with testosterone, zinc is very important for regulating testosterone. So in women, it might be that the testosterone is too high. Men can actually have an issue with too much DHT, which is a different androgen, and zinc helps to block the conversion of testosterone to DHT, which then will help with the skin, because DHT is 3 to 5 times more potent than testosterone, and sometimes testosterone can look normal, but you're not testing DHT, and it's actually DHT that's the issue. So zinc is really important for blocking that conversion and balancing the testosterone. It's used topically to help to reduce bacteria on the skin. Again, stops that conversion happening in the skin, because conversion to DHT can happen within the skin as well. And zinc is a bit of a difficult one to correct through food alone if you have become deficient. So you might need to take a higher dose supplement for a period of time. I would say do it for a month. You don't really want to take high dose zinc for longer than 3 months, because you could offset the ratio of copper, and that can cause some other issues. So 30 milligram of zinc is probably the limit. I wouldn't go over that unless you're working with a practitioner and they know what they're doing and are monitoring you to make sure that you're not going to upset the levels of other nutrients. Again, it can happen if you've got gut issues, so you're not absorbing your minerals very well because stomach acid isn't optimal. You need zinc to actually produce good levels of stomach acid, so there can be a bit of a vicious cycle of your zinc levels are low, so you're not producing optimal levels of stomach acid, but the poor stomach acid is affecting how well you absorb zinc. So in that case, obviously you'd want to make sure you put a supplement in just to boost the levels quicker, because it might be a little bit difficult going around in this circle. Those are all the vitamins and minerals I'm speaking about today. There's obviously other vitamins and minerals that I could have, and other nutrients actually, that we could speak about. So any questions you've got, leave them below. And of course, if you found this video helpful, give it a thumbs up, and I will be chatting to you soon about more nutrition and acne tips.